that you purchased. Okay, so ano-ano yung mga component niya? Yung shipping fee, yung receiving, okay, the shipping, the receiving, the stocking, and also the bookkeeping of the inventory. So dyan, yan ang component ni procurement cost. Okay, how about si carrying cost? Carrying cost is inherent to the product itself. Okay? Cost that is inherent to the product itself. Ang disadvantage lang nitong carrying cost class is it may be difficult to quantify for individual items. Okay? It may be difficult to quantify for individual items. And then we have opportunity cost. Okay, so sa opportunity cost class, it is the cost of something in terms of something else that could be purchased and sold instead. Okay, opportunity cost, the cost of something in terms of something else that could be purchased and sold itself. Kumbaga ito yung instead. Okay, kumbaga ito yung alternative ng something na wala kayo pero meron siya, meron kang pwedeng isuggest na alternative tapos nabenta mo. Okay, yun yung opportunity cost. Okay? What is disadvantage is yung ano mismo, yung product mismo na binigyan nyo ng alternative, halimbawa, si product A, yun ang gusto talaga na i-purchase ni customer or ni patient, and then wala kayo nun, and then nag-suggest kayo ng alternative na uh, drug B, okay, product B. You suggested another alternative which is the same sa product A, si product B. Okay? And then, pumayag si patient that she will purchase na lang si product B. And then, nabenta nyo. Ano ang disadvantage nun kay product A? Mag-loss ng potential gain. Okay? So, kung baga, na-introduce nyo si product B, the next time around, ako kayang possibility nga yung product B na lang ang bilhin ni patient. Kasi the patient will think na, this is readily available in your butika or in the hospital pharmacy. So, yun na lang din ang bibilhin ko. Why would I go to other hospitals pa or outside ng hospital if meron naman sa loob yung product B and then it's the same with product A? So, again, mag-loss ng potential gain sa product A and other alternatives when the specific alternative is given. Okay? But then again, kahit ganun class, it's a win-win situation pa rin naman kasi you have given the patient alternative. Therefore, miskan wala ka atong product A na akay ways on how to provide the need of the patient. Okay? And then, that's what you call opportunity cost. Okay? And then we have customer dissatisfaction. It is one of the hardest cost to determine class, si customer dissatisfaction. But, it is observable. So, makita mo naman yan if hindi na-satisfy si patient sa yung service, sa products and services na give mo. But again, mahirap siya i-quantify, kaya nga mahirap siya i-identify na cost. Okay? But again, observable siya. Okay, so let's proceed with the means of selection. This is the last one. Okay, so we have 4 means of selection of the items that we are going to enter or gusto nating ipapasok doon sa hospital pharmacy. We have the ABC analysis. Okay, so ito si ABC analysis class, it categorizes items by volume and value of consumption. Kaya nga siya ABC analysis kasi merong 3 categories, A, B, and C. So ano yung A, B, and C? Si A class, 10 to 20% of items, and then 75 to 80% of expenditures. Okay, so waste ito siya ng class sa inventory. Okay, so this is the means of selection of items to stock. Okay, so paano mo isa-select yung mga items na gusto mong i-stock doon sa hospital pharmacy. Okay, again, ABC analysis, A, B, and C. Anong dito kay A class? Dili siya kaayo daghan. Okay, what's advantage is it's not too many, 20% lang gud sa items. Okay, not too many kay para makontrol nimo og maayo ang imuhang items para mas madali mo siya makontrol. Okay, what are the example of this one? Mga antineoplastics natin. Ano yung mga antineoplastics? These are the drugs which are used for cancer chemotherapy. Okay, so dili kaayo ni daghan na to ang gina-stock sa sa atong hospital pharmacy, not unless you're a hospital that is specific to in treating cancer patients. Okay, basically, dako-dako jud ang percentage dapat kasi if you're a specialized hospital specializing cancer, so most of your drugs are related to your cancer jud. Cancer related drugs jud ang inyuhang i-stock dara sa inyong hospital pharmacy. But if you're a generalized type of hospital, so you can follow this ABC analysis. Okay, example of A is again C, antineoplastics. We have B, 10 to 20% items, 15 to 20% of expenditures. Okay, so this is actually a class that lets the system, yung system mismo ang magma-manage. Okay, so you have a system that will help you on how to manage. Okay, so click, manipulate mo na lang yung system and then go na. Okay? Click mo na lang ang system and then madali nyo na lang i-follow. Okay? So, yung mga system natin, ito yung mostly yung category na gina-follow. Okay? So, we have C. C is 60 to 80% of items and then 15 to 20% of expenditures. Itong category naman na to, ito yung pina-follow ng mga fast-moving products. Okay, mga fast-moving products. So, when you select fast-moving products, you can follow category C. Okay, category C. So, 60 to 80% of items. Bakit 60 to 80% of items? Kasi nga, fast-moving siya. So, dapat madami ka talagang stocks. Okay, kasi fast-moving. Example of this one is your OTC medications. Okay, what else? Yung mga maintenance drugs natin. Okay, sila talaga yung mga fast-moving. Okay, and then let's proceed with the next means of selection. We have individual prescription patient medications. Okay, individual prescription patient medication. Okay, this is a preparation or compounding of multiple doses for each patient. Okay, preparation or compounding of drug of multiple doses for each patient. Okay, ito yung mga prefer class sa mga small hospitals. Okay, kasi they have ample of time to compound or to prepare multiple doses for each patient. The bigger hospitals has actually meron din naman sila kasi meron man silang manpower, enough manpower doon. But yung mga bigger hospitals kasi, some of them follows automated medication dispensing na. Okay, they follow automated, medication dispensing and also the unit dose. Okay, so that is why hindi na to masyadong pina-follow ng bigger hospital. Mas prefer ito ng mga smaller hospital kasi nga, those smaller hospital, cheaper kasi itong individual prescription patient medication. Cheaper ito siya in terms in comparison to unit dose and automated medication dispensing. Okay, that is why yung mga smaller hospitals na merong small pa na capital, small budget pa sila, they are still starting, they can follow this one kasi it's cheaper. What are its advantages? Less probability of medication error, and then it provides interaction to pharmacists, doctors, nurses, and as well as the patient. So magkakaroon ng magkakaroon ng pharmacist, doctor, nurse, patient relationship because of the individual prescription. Kasi ganito yan class, doctor will prescribe the drug, and then after that the nurse will order that to the pharmacy, and the pharmacist herself or himself will prepare the drug, will compound the drug in multiple doses depende kung ano yung reseta ni doc, and then after that the pharmacist will give back that to the nursing station, and then the nurse will give that to the patient. But before that, you are going to orient the nurse on how to administer the drug to the patient kasi you're the one who is knowledgeable enough on how to administer that one kasi nga ikaw naman yung nag-compound, ikaw naman yung nag-prepare. Okay, so you will have actually interaction with the other healthcare professional as well as the patient. Actually, hindi nga masyadong ganun kay patient with the other healthcare professional kasi nurses are the ones who has direct contact talaga with the patient sa loob ng hospital. Okay? What are the disadvantages? Aside from that pala class, one of the advantage of individual prescription patient medication is that it provides closer control of inventory. And then what is the what are the disadvantages? Hago siya class, it's laborious masyado, and then it's time consuming, and then merong delay of administration. Okay, kasi nga it's time consuming. So dako ang tendency nga dili dayon ma-administer right there and then pag order ni doc, I need this type of drug, tapos i-compound pa man nimo na, i-prepare pa nimo na. So dili dayon nimo mahatag kay patient. So there is again a time delay. Mayroong delay of administration. Okay? And then we have the unit dose drug dispensing system. So ito yung sabi ko kanina, bigger hospitals follow this one. Okay, the unit dose drug dispensing system or the UDDDS. Okay, dili davod that squad ha, it's unit dose drug dispensing system. Okay, UDDDS. Okay, so it's the preparation of single dose good for 24 hours for each patient. So you prepare the drug in a day, okay, by according to the 24-hour need of the patient. Okay? It's the safest and most accepted method sa hospital. Okay? It's actually the standard of practice in most hospitals today. Okay? We have different UDDS. We have the centralized, decentralized, and the combination of both. The combination of centralized and decentralized. When you say centralized class, yung mga stocks nandoon sa main or sa central pharmacy. Okay? Doon sa main or central pharmacy. Do you know the SPMC sa Davao, yung government hospital ng Davao City? They have satellite, they have main pharmacy class sa loob ng, kasi SPMC is very big. They have pharmacy, they have satellite pharmacies. Okay, meron silang main, meron silang central pharmacy, and then meron silang satellite pharmacies. Okay, marami silang pharmacy sa loob ng hospital. Every building, merong pharmacy. Okay, kasi iba yung building for cancer, iba yung building for orthopedic patient, iba yung building for pediatric patient, iba din yung building for general population. Okay, so that is why if you have come to SPMC, makikita nyo ang daming maka-separate na buildings. Because the buildings is intended, depende kung anong need ni patient. So, ganyan yun sila. Meron silang central pharmacy which is very big, and then they have satellite pharmacies to the different buildings. Okay, so ganun ang setup ni SPMC kasi nga masyado siyang malaki, too big of a hospital siya, that is why hindi kaya kung isang pharmacy mas organized if mayroong satellite pharmacy. They are already following unit dose drug dispensing system. Okay? Although they are government hospital, pero ang feeling nimo sa ilaha is mura sila private hospital because they follow this one. Okay? Again, kapag centralized, the stocks are in the main or the central pharmacy. Okay? And doon yung stocks are in the main or central pharmacy. Decentralized naman, there are satellite pharmacies catering nursing stations. Okay? So again, may mga satellite pharmacies na nagka-cater ng nursing stations. How about the combination? The combination, itong combination na to class, it is employed in government hospitals. Okay, so as I've said, si SPMC, they follow unit dose drug dispensing system. Okay, they combine. Mayroon silang combination. Meron kasi silang main pharmacy, central pharmacy, and then this pharmacy distributes to the satellite pharmacies. Okay, and then si satellite pharmacy, ito yung nag-cater sa mga different needs ng different drug needs ng mga nursing stations. Okay? So what is the advantages of unit dose? It is cheaper for patient class. It is cheaper for patient, but sa hospital, it is more expensive. Okay? Pero sa term sa kay patient naman, on patient side, it is cheaper. And then, the nurse has more time for direct patient care actually. May more time si nurse kay patient care kasi ando naman na kasi sa kanila yung pharmacy mismo, nasa tabi na lang nila kasi may satellite pharmacy. So, they don't need to go to the central pharmacy para kumuha ng drugs kasi may satellite pharmacy na. The central pharmacy and the satellite pharmacy will be the one who will carry or who will bring those medicines doon sa satellite pharmacy, which is nasa tabi na lang ng nursing station. Okay, so in return, meron na si patient maraming time para magkaroon ng direct patient care. Okay, and another advantage is it decreases medication errors and also it eliminates excessive paperwork. Okay? So that's unit dose drug dispensing system. Okay, are you still there? Okay. So this is the last slide. This will be the last slide, class. So this is the automated medication system, the last means of selection. So we have again four means of selection of items to stock. Okay, we have the ABC analysis, the individual prescription medication system, individual prescription patient medications, and then we have the unit dose drug dispensing system and the automated system. Okay, so si automated system class, so what do you mean by automated system? When you say automated system, it is a dispensing in which yung device na mismo ang nagdi-dispense ng medications and nagfi-fill ng prescription. So, can you imagine? It's an automated dispensing na class. So, sa pharmacy practice, yung device na mismo ang nagdi-dispense ng medications and it fills the prescription. Okay? So, kumbaga, mura na siya robot. It's a device, dili siya robot, but it's a device na automated na i-manipulate lang nimo ka siya, mag-execute lang ka dito og action, and then, sa computer-based man good siya, and then, bahala na si device mag-dispense and mag-fill atong medications niya. Okay? Although it's less hago na siya sa manpower, it is not considered as an official drug distribution system. Okay, kasi hindi pa siya ganyan katagal sa practice. Okay, they are still looking what are the loopholes for the automation. Okay, kasi there are really pros and cons for automated dispensing machines, and right now they are still studying that one. That is why unofficial siya na drug distribution system. Okay, so mahal kasi siya, class. High capital ang kailangan mo dito. So, magkakaroon ka ng high capital expenditure. So, kailangan mo talaga mag-invest in automation. Kasi nga, mahal. Mahal yung device. It will cost you millions to design, to fabricate, and also to install the automated medication system. Tapos, aside from that, high maintenance din siya. Okay, so kailangan nimo na adjay personnel nga on duty permi na na mag-handle sa medication system kasi nga anytime pwede siya maguba. So kung maguba siya, mag-unsa man, 'di ba? So kailangan na personal na permi on call jud na siya, class 24/7. As long as the pharmacy is open, dapat on call pud tong personnel that is expert on the AMS, automated medication system. Okay? So again, so higher level of maintenance siya compared to those mga manually operated machine. Okay, tapos dili siya yung anak kataas iyang flexibility, class. Low degree lang ang iyang flexibility. Okay? How about the advantages? Despite of that, it provides secure, despite sa mga disadvantage niya, one of the greatest advantages of automated medication system is that it provides secure medication storage on patient care units. Okay, so dili ka mabalaka if maguba ba ang drug or effective pa ba ang drug kasi it secures the medication storage for the patients. Okay, and then ang imuhang tracking sa drugs is electronic na siya. Okay? So, very, very advantage to siya in tracking the narcotics and yung mga PDEA-regulated drugs. So, very effective ni siya class. Dili ka maglisod. Okay? Kasi pwede mo lang i-generate yung report para matulungan kang identify and ma-prevent yung potential diversion. Okay? So, ganun yung advantages ni automated dispensing machine or system. Okay, so right now they are still looking if okay ba siya kasi not all countries can afford, not all hospitals can afford this one, especially if you are in the third world country, dili pa jud na afford sa mga hospitals within that country. Example na kita. Okay, we don't actually follow that one. Our pinaka ano is the unit dose drug dispensing, which is the official drug distribution, not the official but considered as a drug distribution system. Ang pinaka ano man god class ang actually pinaka-prefer noon is the individual prescription patient medication. Okay, yun siya. But we have na unit dose drug dispensing system. Okay, so pagdating ni unit dose drug dispensing system, yun na siya ang naging standard of practice sa most ng hospitals today. Okay, so do you have any questions? When you say combination, saan yun? Dito. Okay. When you say combination, is the combination of the centralized and decentralized. Okay? So, combination siya. So, merong central pharmacy and then merong satellite pharmacies. Okay? So, again, combination siya. Meron siyang central pharmacy and then merong satellite pharmacy. Okay? So, ito siya, yung combination class. Merong central pharmacy si hospital and then andoon lahat ng stocks. Okay, andoon lahat ng drugs. And then, kapag nag-order yung satellite pharmacy na ganito, ganyan, I need this type of drug, this type of IVs, this type of fluid and electrolytes, the central pharmacy and the satellite pharmacy will communicate and then dadalhin yung mga stocks na in-order ni satellite pharmacy galing kay central pharmacy papunta doon sa satellite pharmacy. And then si satellite pharmacy class, yun siya ang magbibigay kay nursing station. Kasi the satellite pharmacy is located just beside the nursing station or near the nursing stations. Okay? So each nursing stations merong mga satellite pharmacy to cater for their needs. Kasi iba-iba naman yung mga need ni nursing stations. Kasi the nursing stations depends, the drug that the nursing station depends on what type of patient they are catering. Sa San Pedro kasi class yung ang tawag nito, yung sa experience ko, each nursing station's class is different per floor. So yung nasa 7th floor, yung nursing stations kasi nila is named according sa saints. Saints sila. So, yung sa 7th floor, I forgot na what nursing station, mga saints kasi yung nursing station sila. Yung sa 7th floor, mostly yung mga on is yung mga immunocompromised. So, yung mga may cancer, yung mga may lupus. So, yun yung mga tawag ito, yun yung mga patients na gina-cater nila. And then, sa 6th floor are the pediatric patients. Okay? And then, another floor for kasi isang building lang sila, unlike the SPMC na iba-ibang building sa kanila per floor. So, ang ano nila, ang ibang floor naman is for the IM, tapos may ibang floor na sa lahat lang ng mga nanganganak, and then isang floor din na for dialysis lang. Okay, so ganun yung ano nila. Each nursing station is again nakadepende kung anong kailangan ni patient, kung ano yung diagnosis mo. What are the probabilities of your diagnosis? So again, kapag combination, merong centralized at decentralized, okay? So, merong main pharmacy, merong central pharmacy or main pharmacy, and then this main pharmacy will distribute to the satellite pharmacy, depende kung ano yung gi-order ni satellite pharmacy. And the satellite pharmacy na ang bahala na ibigay doon sa nursing station. And then, remember that each nursing station has satellite pharmacy. Okay, that's the combination. Itong combination na to, ito yun siya yung employed mostly in the government hospitals. Okay? Other questions? Asa dere, inventory control and management.